So, okay, good luck.
Okay. All right, so I'm going to talk today a little bit about how the Israeli healthcare system works, and how, as a new Ole, you can best navigate it. I remember when I first made Aliya 25 years ago, people were tossing around all these terms as if I were expected to know what they were talking about, and I did not. So this will just be a little bit of what you need to know. Obviously not everything, and you're more than welcome to be in touch with me, afterwards, obviously during the lecture as well if you have specific questions, but also afterwards if you want to email me about anything more specific. So first, just a couple of general facts about the Israeli health, the state of health in Israel. So we have, I believe, the highest birth rate in the Western world. Over 3%. Actually, interestingly enough, the Arab birth rate is going down and the Jewish birth rate is going up, not only in Orthodox populations, but really across the board. And the life expectancy is relatively high, okay? It's over 81 for men and over 84 for women. So it's a good place to live long. The system is basically a public system, but there is more and more privatization, meaning that there are more opportunities. You can call it an opportunity, or you could call it, perhaps something less than ideal. But there's more of an influx of private health services, which again offers more of a choice, but may to some extent lessen the quality of the public system. On the other hand, the public system is excellent. Okay, I'll explain a little bit more as I go on how that translates in practical terms. There are 4 health funds, 6 medical schools, and 45 general hospitals. Okay, that doesn't include psychiatric and geriatric hospitals. And those 45 hospitals are a combination of government hospitals, hospitals owned by the health funds, and private hospitals. Okay, so the Israeli healthcare system is basically under the auspices of the National Health Insurance Law, which was enacted in 1995. Okay, the health funds, the kupot, actually were in existence before that. But what the National Health Insurance did was basically provide universal coverage. In other words, every resident of Israel, according to the law, is entitled to health insurance. All right, there's a standardized basket of services, which includes doctor's visits, hospital visits, basic medications, all sort of the everyday things you would need in a health system. And that is the same across all 4 health funds. In addition, each health fund offers what's called supplementary insurance. All right, often they offer 2 levels of supplementary insurance. And those offer things that are not included in the basic plan. So that could be certain medications that perhaps aren't included in the basic plan. It includes, if you want, let's say, to have surgery with a specific physician, all right? So if that physician contracts with your health plan with a supplementary plan, you can request to go to specifically that physician. It includes things like complementary medicine. What makes the supplementary insurance different from the standardized basket is that while the standardized basket, as I said, is identical across all 4 plans, the supplementary plans do differ, all right, between the 4 plans. And so it's a good idea. First of all, I encourage everybody to take out at least the first level of the supplementary insurance. It's quite inexpensive, all right? I just checked for somebody 2 of the plans. And although the cost goes up with age, it caps out at about between 60 and 80 shekel a month for the basic supplementary plan, the first level supplementary plan, which is really not a lot of money, and it gives you a lot more options. And what I suggest that you do is really you go on the website of the health fund that you're looking at. They each have a website in English. And you can take a look and see what the supplementary plan for that kupa, for that health fund offers, and if it's something that would be useful to you. So basically, when you make Aliya, you will automatically register as a member of one of the health funds, all right? You can do that immediately upon making Aliya, all right? Even at the airport, when you fill out the initial paperwork, You can say which health fund you want to be part of. And then afterwards, you'll take the slip of paper that they give you to the office of that health fund, and there you'll finish the process. They'll give you your magnetic card. You can sign up with a supplementary plan if you wish. If you don't know the moment that you come to Israel yet, if you don't know which health fund you want to be a part of, you have 3 months that you can sign up with one of the health funds. And of course, you can switch, all right? There's 6 opportunities during the year that you can switch. You're allowed to switch twice a year, so you don't have to feel like you're locking yourselves in for life. The health funds, okay, this is part of the universal coverage. Health funds cannot bar applicants for any reason, okay? It doesn't matter how old you are. It doesn't matter how many pre-existing conditions you are. They have to take you. And that includes the supplementary plan. All right, I'll get to the waiting period for the supplementary in a minute, but both the basic plan and the supplementary plans have to accept every Israeli citizen. Now, how is this paid for? It's a progressive tax, which is basically a percentage of your income. It's roughly about 3% of your income. All right, I'm talking again about the basic level. And Olim, if you're not working, you're exempt for the health tax for the first 12 months. The public health system is funded from, you can see from this chart, it's mostly funded, although not by a large margin, from this health tax, from the health insurance fee that you'll pay through your salary, or if you're not working, you'll be paying a flat fee. You pay, the state, from the state budget pays about 46%, and then a small amount is co-payments. So how do you choose which health fund you want? As I said, there's 4 health funds. And again, the basic level is the same for each. So basically what I would say in terms of choosing is dependent on 2 factors. One, as I mentioned, is what does that fund's health supplementary plan offer? And are those things that would be useful to me? And the other thing is, how strong is this specific health fund in the area where I'm living? All right, because in terms of quality, you know, they're roughly the same, but certain health funds have more doctors in certain areas. All right, Jerusalem, for instance, Mu'chedet is by a small margin considered the strongest fund. Tel Aviv, it's more Makvi. But again, that does not mean there's plenty of people in those areas that join one of the others, Klalit or Leumit. And you just have to sort of see what's best for you. Leumit, for the most part, is not the best choice if you're living in a city. It's usually the health funds in the kibbutzim and the moshavim and the more outlying areas. But again, they're all open to you, and you can choose which one you wish. By the same token, if you've heard about an outstanding family physician, it's been recommended to you by a friend, and you want to use him, then you might want to choose the health funds which he's associated with, and often they're associated with more than one. So how do I join? As I said, you can join at the airport, or you can join within the first 3 months. And if you join within the first 3 months, you'll go to a branch of the post office, of your local post office, and there you can sign up, and you would change the same way. You can also do it through the internet site of the Bituach Leumi to sign up for the health plans. Okay, so as I said, these are the 4 health funds in Israel. They each have a website, and to the best of my knowledge, they each have an English section to their website. So I do encourage you to sort of surf around and get some more information. So what is the basic service, the basic health basket cover? It covers doctor's visits to primary care physicians and to specialists, lab work, imaging such as ultrasounds, x-rays, CT, MRI. Again, you know, not in every case. It has to be recommended by your physician, and the health fund may have to approve it, but for the most part, unless it's a really exceptional circumstance. Hospital admissions, surgeries, paramedical services like physiotherapy or occupational therapy, medications, which do have a small copay, and dental care until age 18 and over age 75 is covered by the basic service. That's something that just came in the last few years, actually. What's not provided is optometry, dentistry between the ages of 18 and 75. And those two things you can get through the supplementary plans, more or less, depending again on which plan and which level, but for the most part. And chronic nursing care is not provided by the basic plan, and I'll just touch on that towards the end. So a little bit about primary care. Primary care includes basically family doctors and pediatricians. So you'll choose one when you join your plan. You'll choose the physician that you want as your primary care physician. And that's the physician that you pretty much need to see every time, unless you absolutely need him at a time when he doesn't have hours and you want to see somebody else. Then the health fund will sort of open it up for you on the computer that you'll be able to see somebody else. You can change your primary physician every quarter. And again, if there's a specific reason why you would need to change it before, then you would speak to the health funds. And the family physician or the pediatrician basically is in charge of your overall health care. He or she serves as the case coordinator and will provide referrals to specialists. You do not need a referral from your primary care physician for orthopedists, for gynecologists, for ophthalmologists, dermatologists, or ear, nose, and throat doctors. All the others you would need to go through your primary care physician. Specialists are located either in community clinics or in hospital outpatient clinics. And if you're going to a hospital, you may need what's called a Tofes Shvasre, okay, which was one of those terms people expected me to know, which is basically just a form saying that your health fund will cover the cost of the hospital visits. So how do you make an appointment? Really simple, and much more simple, as I said, than when I came here 25 years ago. You could either do it online. That's probably the easiest way. Some physicians will have an automated phone service where you just sort of press in, what you want. Each fund will have a 24-hour call center, which is helpful in cases where you need to see a physician. You don't have a preference for a specific physician. You just want the one that has an appointment today. So you'll call the 24-hour call center and they'll, send you to an appropriate physician. Or sometimes you just you can make the appointment directly through the clinic. Now, what changed, over COVID was that all the funds started to offer phone or video appointments, okay? Since it's certainly at the beginning, the physicians didn't want you to come and you didn't want to go unless it was, unless there was no alternative, but many things you really can be accomplished by phone or by video. And a lot of that has stayed on. So even today, even after COVID is pretty much gone from Israel, thank God, you can still do certain appointments if you just really need to ask the doctor a few questions or show him something. You can often do that by phone or by video. The internet site of each fund is a very valuable resource, okay? It gives you general health information, discusses your rights and benefits. It has a copy of your personal health file. You can get requests from primary physicians, okay? If you take a medication on a regular basis, you don't have to go to the doctor every single time you need a prescription. You just put in a request through the sites and you'll get the prescription through the site, okay? You don't even need to print it out. It's sent to the pharmacies and you just show up to the pharmacy with your health fund card and they'll give it to you. You also, let's say if you work, okay, and you need what's called an ishur machala, you need a note from the doctor basically saying that you were ill that day and couldn't come from work. So that's also something that can be done through the sites. You can purchase travel insurance through the site. And as I said, there are a lot of opportunities for e-health, which can be done through the site. So this is I took a few screenshots just so you can see what the internet site looks like. Okay, this is the Makvi site in Hebrew. And basically what it says at the top, first of all, at the top left, well, it's my left, I don't know if it's your left, there's a place to click on for the online services. In other words, for your own personal services, which has a list of your appointments and your physicians and your health records and your medications and everything like that. You can look up a doctor online if you want to know, which gynecologist practice in Tel Aviv or what office hours does this specific physician has. You can find out your rights and benefits as a member. Okay, there's some general information. They have like a magazine. And those are pretty much the things to do. They have a place to make an appointment, to make requests from your doctor, as I said, to get that Tofes Shvasre that I mentioned before, okay, to get the form that will allow you to visit the hospital. You can get lab results online, and all sorts of things like that. They also have a relatively new thing, which is sort of emergency care, which I'll get to in a second. Okay, and this is a screenshot of the English site. This is also Makvi, but as I said, the others have it as well. And while it's not a complete translation of the Hebrew site, it does pretty much have the main things that you would need. I don't think you can sign up for an appointment on the English site, but in terms of information, okay, if you look at it, says on the site healthcare plans. So it says Makvi Gold and Makvi Shalit. Those are the two supplementary levels, all right? So if you want to see what's included in the supplementary levels, you would click on those. Okay, what happens if you need a doctor after hours? So that differs by health funds, all right? Most of them do have a 24-hour helpline, which is staffed by nurses. And if the nurse feels that you need to speak to a physician, then of course they'll connect you to a physician. There are emergency clinics such as Terem, where you go to and you pay a small fee. And there you can get basically emergency care. All right, I've taken my children there for stitches, or if somebody fell and you needed an x-ray to see if there was a break, and you don't want to go to the emergency room, okay? Because not everything warrants a visit to an emergency room, and it won't always be covered, all right? Emergency room visits are covered if you end up being hospitalized. They'll be covered in case of a traffic accident, and there are certain other things. Obviously, if you get a referral, all right, if you get a referral from your fund to visit the ER, then it will be covered. So sometimes if you're not sure if you should go to the ER, it's worthwhile to call the funds and ask them. And if they feel that it warrants a visit to the ER, they will give you a referral, and then you'll be sure that it will be covered. And if not, then they'll tell you what to do. And in certain cases, you can get home visits by certain services. Okay, just to jump back to the supplementary insurance. So as I said, there's no exclusion criteria, all right? You can join at any age and with any illness, but the cost varies according to age. But it caps out at about 60 to 80 shekel a month for the first level. It's very, very inexpensive. Certainly if you're younger, it's maybe 20, 30 shekel a month. And that's why as I said, I do encourage everybody to get it. Over 80% of the population has at least the first level of supplementary insurance. Now, there is a waiting period when you switch funds, all right, because basically they don't want people to not pay for the supplementary and then wake up and say, oh, I need, this surgery or whatever, let me join the supplementary fund. So they do have a waiting period, but first of all, Olim are exempt from the waiting period within 12 months of Aliya. So if you join the supplementary plan within a year of making Aliya, it kicks in right away. And if you are in a certain health funds and part of that health fund supplementary plan, and then you want to switch to another health fund, whatever time you were in the supplementary plan of the first health fund will count towards the waiting period of the second health fund. Now, there is also private insurance, all right, for people who are like a little bit insurance crazy and like to know that they have every coverage available. So that gives you yet another level. It's not really necessary if you ask me. I mean, people may differ, but you might want to purchase it if you want to be sure that you'll be covered in all kinds of situations, including, surgery overseas or the most rare medications, et cetera, et cetera. However, unlike the health funds, private insurance does not need to accept you, all right? So if you have a pre-existing condition, it might be difficult. And two, it's considerably more expensive than joining the supplementary plan to the Kupa. But you can turn to one of the companies, Harel, Phoenix. They all offer private insurance, and you can always look into that as well. So what does supplementary cover covers operations at private hospitals, all right, and with private surgeons, complementary health, subsidized medicine, which is not in the basic basket, discounted dental care and eyewear, which, as I mentioned, are not covered by the basic plan, postnatal recuperation centers, all right, after childbirth, IVF beyond the basic plan, okay. I think IVF covers two children, and if you want more than that, you do it through the supplementary. Expanded prenatal testing, surgery abroad, second opinion with specialists. This is to give you sort of a taste. But as I said, you have to check the specific plan of your health fund and whether it's included in the first level or the second level. All right, just to give you an idea of a few, again, a few terms that you might want to know. So Shaban, all right, that's the sort of the acronym for the supplementary insurance through the health fund. All right, Sharap is basically private insurance in a public hospital, and that's often also offered by your health funds, but that basically means that you can pay for a private doctor to do your operation, but in a public hospital, okay? That's not in every single hospital. It's in Hadassah and Shaare Zedek, but also that's another option for private care. Hesder Hechzer, that just means that about 2-3 years ago, they changed the system, whereas before you could go to a private doctor and then you would pay out of pocket and get a certain percentage back. Today, it's more like the HMOs, where you don't have to pay out of pocket, but at the same time, you can only go to a physician who contracts with your health plan. And Chok HaTzinun basically requires, it's also a relatively new law, which is designed to prevent physicians from soliciting patients to their private practice, okay? Many physicians serve practice also in the public system and in the private system. And they don't want you to go to a physician in the public system, okay, through your fund, and he's going to say, well, you know, I can do this for you in the public system, but if you want to see me privately, I can do it much quicker. So what the law says basically is that if you see a physician in the public system, he or she cannot see you for the next 6 months in his private practice. So that's just something to be aware of. All right, the health system includes Tipot Chalav, which covers well child care until age 6, all right? The pediatricians generally do not do well child care. You know, developmental checks, things like that, that's done at Tipot Chalav. And they also offer immunizations, childhood immunizations, which are later done in school, okay? The immunizations given in grades 1 to 3 are done in school. And as I mentioned, I'll just touch on long-term nursing care. So basically that includes, that comes into play when an individual is unable to perform at least 3 functions of daily living. All right, and then you can get it from one or more sources. In other words, Bituach Leumi, which is Social Security, will fund up to 18 hours a week of home care, again, depending on the level of disability, etc. You might want to join, again, this is something when you join your initial plan, when you go in to sign up at the health fund, it's worth looking into what's called Bituach Siudi, or long-term care, all right, through the health fund, because it's much less expensive than buying it privately. However, in real time, it'll pay less, all right? So basically, it only will cover for a maximum of 5 years, and it'll cover between 3,500 and 5,500 shekel a month for home care, or 4,500 to 10,000 for institutional care, but the actual cost might be more. So you might want to take out private insurance for that, or you might feel that you have enough savings that you could supplement if you know the need would arise. Obviously, that's a personal decision for everybody, but again, it's something that's worth looking into. And of course, you know, as elsewhere in the world, the earlier you join, the less it's going to cost. So that's pretty much an overview. I saw that there were a bunch of questions on the chat. I didn't see the questions themselves, but
I will ask the question.
For questions, yeah.
Okay,
and I put my email here too, so you can always write to me.
Great. First of all, thank you for your brilliant lecture. Few questions. One of them, what about returning citizenship?
So returning citizens do not get covered for the first 6 months. All right, but you can redeem that period for a cost of about 12,000 shekel. Or you can bring with you private insurance from wherever you're living now if you want to cover yourself for those first 6 months. Those are basically your options, but you certainly don't want to be without coverage for that time.
Okay, good. And if someone retired or making Aliya after the age of retirement, does it get health insurance? How does it work?
You do get health insurance. I believe that you pay a small flat fee. Obviously, you're not paying a percentage of your income if you're not working, but yes, you're certainly covered.
Okay, and if you are not working in Israel, you're keeping your work from overseas, and you just made Aliya, so no one is paying your health insurance. How does it work?
So again, that's like when you're self-employed. Again, you would pay a flat fee.
Okay. Someone asked about Makvi in Haifa. Do you know anything about it?
I don't really know.
Okay, and maybe I will add something on that. Whenever people asking me which health foundation should I register to, as part of what I'm saying here all the day is like when you're doing the research, where to live, where to send your kids, which school, where to work, ask also about the health foundation. I grew up in Be'er Sheva. In Be'er Sheva, we used to go to Clalit because the hospital was belonged to Clalit, so most of the clinic were Clalit, and it was, you know what, everyone go to. I know in Ra'anana, people usually going to Maccabi because Maccabi is strongest in Ra'anana. So wherever you're gonna live, ask the people, ask your neighbors. Even when you're finding an apartment, look around your apartment, which clinic is close to your apartment. You can always switch to another health foundation. It's more relevant if your health status is very easy health status. If you're coming with difficulties already, with background disease, it's better to explore which health foundation, which doctor has a specific specialty to give you support. I always talking to people that have Crohn, diabetes, or any other chronic disease that they are dealing with to explore before where are the best doctors at giving treatment in the same way that they wish to be treated, to even contact them before they're making Aliya, to make sure that their treatment plan will be keeping in Israel whilst they are in Israel. In order to know which medication are getting covered by each health foundation, you need to contact the health foundation or to see on the website of the Ministry of Health which medication are in the basket. The basket are approved every year. Like maybe 1 year it's not approved, the next year it will be approved. Some medication will go out because it's too expensive and there is less patients, some will be in. There is a lot of debate around medication are in the basket or not. You need to track and to see what's going on, or maybe to be in touch with a health foundation that you're gonna go to and check with them whether your medication is covered or not.
Yeah, I just want to, Liat, if you don't mind, I'm just going to add that. First of all, that was very helpful what you just said, but in terms of the coverage of the medications, it is a good idea, of course, to check, as Liat said, on the Ministry of Health website to see which medications are covered. But you have to realize that the medication will only be covered for the indication for which it's listed. So you might be getting, let's say, a medication which in England is used for disease X, but in Israel is only used for disease Y, and then the health fund won't necessarily cover it. So the best idea, if you have a specific condition, is to as Liat mentioned, speak to the health fund in advance, maybe get a letter from your doctor explaining, you know, your personal situation, and then you'll have a more clear answer.
Thank you, Malke. One more question for psychological appointment.
Yeah, so you can do that through the fund. It does take a long time to get. There aren't that many psychologists, or you can go privately and pay.
Maybe to add that to what I ask you, all the mental health support, psychological, psychiatric, brought back from the government treatment to the health foundation treatment. So actually in your clinic or in your area, you're supposed to have ability to meet psychologist or psychiatrist to give you treatment. It's not as it sounds, because as Malke said, there is not a lot of psychology people that willing to work in the health foundation. They're getting much more money from private clinic and from other organizations, but we do have not enough. You need to wait. And sometimes you also get like not as much meeting as you wish to get. You will get like 6 meetings to assess you, and then the psychologist can apply for like 20 more meetings. So depend what is your status. Which foundation speak English, Malke?
I would assume that they all speak a basic level of English. And again, if you want to choose a specific doctor that speaks English, so that would be another, consideration in choosing your doctor. If you want somebody that's fluent in English, and that's something you can find out through referrals.
Okay. Just to know, all the doctors are supposed to speak English when they're studying medicine in Israel, when they do the licensing exam. Israel do test their English level. They read most of their books in English. So they're supposed to understand and to be able to communicate. In general, the level of English in Israel is high compared to other countries around the globe. So usually you're going to find someone that speak English. Even if you call your health foundation and there is no one there that can assist you, ask him to transfer you to someone that can communicate with you in English. And eventually, as I said before, if you will explore it a bit, people are going to tell you, go to this clinic because the secretary there is an Anglo-speaking person, and the GP is an Anglo-speaking person, etc., etc. Don't go just by the flow. Explore and research. This is your responsibility. One more question, Malka. Like if you're going on Makvi, for example, in Ra'anana, can Makvi insist you to go to one hospital and not another, or can you go to any hospital that you want?
No, pretty much today you can pretty much go to any hospital, I believe. I think that's changed in the last thing. I'm not 100% positive, but I think for the most part that's the case.
Yeah, for general, if it's an emergency case, you can go to any hospital. Emergency case, all the hospital going to accept you and give you treatment, and eventually they're going to deal with your clinic to get the refund for that. If it's not an emergency, some of the health foundation have contact to some of the hospital, and they will prefer you to go. If they are Clalit, they will prefer you to go to Clalit hospital. It's easier for them. It's easier on the system. It's easier to transfer money. But you still can go, and I can tell you because I in Israel lived in the periphery, in the south, and I used to take my kids, God forbidding, when I need to take them to hospital, I used to take them to which hospital that I picked. I can jump to Tel Aviv hospital or to Petah Tikva hospital because I felt I'm getting a better treatment there. So I took my kids wherever I felt I should go to, usually an emergency. But even when I got like a letter from the doctor to go to hospital, I would prefer like a kids hospital or something like that. Malka, any more suggestion, question? So let me add a few things to you. First of all, if you have any health condition, please prepare your document. Now go have a proper document from your doctor to explain all the history of your situation. What is your background? Which medication have you treating with? If one medication is not good for you, it should be written on the doctor letter. If you have a health situation, start to explore the best people to come to meet in Israel before you stepping into Israel. We always recommend Olim to come with 3 months medication in advance. Before you live in your country, ask your doctor to give you 3 months medication in advance until you will settle and find the right doctor. Maybe the medication in Israel is a bit different and you will need to have more time to adjust and to understand what you are actually looking for. So just to be on the safe side. I see a few more questions on the chat.
I saw somebody just asked about cardiology and pacemakers. So, I mean, that's a fairly standard thing, and it shouldn't be an issue that would be covered just by basic care. Again, your cardiologist here would have to feel that you needed a pacemaker, but assuming that, it's standard medical care for your condition, then it wouldn't be an issue.
Okay. I saw that someone said about Wolfson and Clalit. I think this is like specific case, but besides that, I think we're good. Any more questions to Malka?
So there was one about ADD, ADHD. So that, again, you would need your pediatrician to refer you to a child neurologist probably, and they would do an evaluation.
Okay. How does it work with children and therapy?
Yeah, so again, it's the same thing. Your pediatrician would refer you to a specialist, and then you would work out a treatment plan. I assume some of the therapies would be included, and some might be included, through the supplementary, and some might be private. I don't know specifically that area that well, so.
Okay. Speech play. Okay. One more thing maybe to add to you, Malka. Some of the therapists for kids you're getting from like your teacher and the Health Foundation together put in a report and sending you to מרכז להתפתחות הילד, the Center of Development of Child. And there you can get treatment, okay? Some of the schools do offer treatment in the school. Some of the Health Foundation do give treatment in the Health Foundation. Which document would you need to bring 3 months of medication to Israel? No document, like whatever, you don't need a document with it. As long as you have your letter information from your doctor, you can just come with it and show that you have your medication. Israel won't ask you about those medication. If it's a private medication, you can carry it in and use them, but just bring it with you before you're making Aliyah. Crohn disease medication, Malka, do you know if it's covered usually?
For the most part, it's covered, yeah.
Yeah. Okay. Malka, I think it's it. We have a quiet chat for now, or someone else want to ask more questions?
Okay, as I said, you can also email me afterwards and I'll get back to you.
Okay, and I think health, it's one of the most personal process. No health situation is the same as other. So better to contact and to do, to start the conversation before you're making Aliyah with a place that you want to be in. Malka, thank you very much for coming today.
My pleasure, and best of luck to everyone.
Availability to meet people.
So I don't have any availability today, actually, but as I said, people can be in touch with me personally and I can try to set up a time with them.
Okay, amazing. Thank you, Malka. Thank you very much.
Okay.
And our next lecture in, I think, 20 minutes. Okay. Bye for now.